Hello students, today's topic is physicochemical principles in pharmacology. The pharmacological and pharmacokinetic properties of a drug depends on its chemical structure. It affects the interaction of the drug with receptor, the ADME and response. The physicochemical properties of a drug helps to predict the behavior of the drug before and during the transit through the body. Hence, it is important in drug designing. The various physicochemical properties of the drugs are its solubility and dissolution rate, particle size and effective surface area, partition coefficient, dissociation constant, pH, ionization state of the drug, chelation, solvates and hydrates of drug, polymorphism and amorphism, protein binding, stereoisomerism, and hydrogen bonding interactions. Solubility and dissolution rate. Solubility can be defined as a property of a substance or solute to dissolve into a homogeneous solution. The process by which a solid substance gets solubilized, that is, from solid to liquid phase, is called dissolution. The solubility and dissolution property of a drug affects its absorption in the system. A hydrophilic drug has more aqueous stability and dissolution. The amount of solute or drug that dissolves into the solution per unit time under standardized condition of temperature and pressure is called as rate of dissolution, and it is estimated by Noyes and Whitney's equation given here. The dissolution process of a orally administered drug is illustrated in the figure on the right. The effect of drug is not based on dosage but its absorption. The rate determining step of absorption of an orally administered drug is its dissolution rate and permeability across the membrane. Dissolution is a rate determining step for hydrophobic drugs, while permeation is the rate determining step for hydrophilic drugs. According to the biopharmaceutical classification system, the drugs are categorized based on its solubility and permeability, as represented in the figure. They are classified in class 1, class 2, class 3, and class 4. The class 1 category has drugs with high permeability and high solubility. The class 2 with low solubility and high permeability. Class 3 with high solubility and low permeability. While group 4 contains drug with low solubility and low permeability. The dissolution rate depends upon the particle size and surface area. Smaller the particle size, greater the effective surface area, greater the dissolution rate. Hence, in case of many drugs which are hydrophilic, micronization of the drug increases the surface area, thereby increasing the dissolution rate. In case of hydrophobic drugs like aspirin, micronization leads to aggregation and flotation when dispersed in media. In such instances, these drugs are coated with hydrophilic dilutants or wetting agents like polyethylene glycol, dextrose, and phenylacetate. It should also be noted that stability of the drug reduces with its size. The powdered forms of drugs are more prone to humidity and oxidation than the coarse materials. The solubility of the drug also depends on the state or form of the drug, that is, hydrated or amorphous state. Amorphous drugs have higher solubility than hydrated ones. Various strategies are used to increase the solubility of the drug. In some cases, the drug solubility is increased when it is bound to certain hydrophilic binders like gelatin. Certain drugs are more soluble in their salt forms, like sodium and potassium salts of penicillin G are more soluble than penicillin G as such. In some cases, the hydrochloride or sulfates of weak bases are used. Example, in case of tetracycline. The table in the right bottom corner mentions the various approaches followed for the oral drug form based on its solubility and permeability. These criteria are taken into consideration while designing a drug and making formulations. Next, partition coefficient. It is the ratio of concentration of a substance in one media or phase to the concentration in the second phase at equilibrium. It is an indication of lipophilicity of a drug and its ability to move across the cell membrane. For unionized molecule, the partition coefficient is calculated as the ratio of concentration of drug in lipid phase to aqueous phase. It indicates the ability of the drug to cross the lipid bilayer membrane. In case of unionized molecule, it can be represented as a logarithm of P. If log P is greater than 2, then it indicates that the drug is lipophilic in nature. Thus, it can easily pass through the lipid bilayer membrane. But it has low water solubility, hence not suitable for oral route of administration. If P log P value is less than 2, it is a lipophobic or hydrophilic drug. If the molecule is ionized in the solution, then the equation is of estimating partition coefficient slightly modifies as shown in the equation on the right. Here, the degree of ionization of the substance A is in aqueous solution is also considered. The functional group and structural arrangement of the atom help to determine the lipophilic or hydrophilic character of the drug. Example, the hydroxyl group and the carboxyl groups are hydrophilic, hence low partition coefficient, while the methyl residues and hydrocarbon rings are lipophilic. These properties are useful in designing chemotherapeutic and pharmacological drugs. In drug designing, the partition coefficient log P value is calculated or estimated using partition media N-octanol and water. Based on the log P value, inferences on absorption of drug can be predicted as shown in the table. If the drug has high partition coefficient, it can be concluded that the particular drug has high affinity or binding capacity to receptors or enzymes. It has high binding capacity to certain metabolizing enzymes, especially the P450 metabolizing enzymes, increased absorbance across the membrane, binding to blood tissues and proteins, but decreased water solubility. The various factors that affect partition coefficient are the pH of the solution or the area, co-solvents, surfactants, and complexations. The pH of the compartment and the ionization of the drug affects the drug properties. pH is a quantitative measure of acidity or alkalinity of a solution. It is a measure of hydrogen ions in a solution and is mathematically calculated as negative logarithm of hydrogen ion concentration. According to the Henderson-Hasselbalch equation, pH can be calculated as sum of dissociation constant and log of ratio of dissociated species to undissociated species in the solution. Therefore, in a solution where concentration of salt and acid is equal, pH equals dissociation constant. As per the equation, as pH decreases, concentration of acid increases and salt decreases. The HH equation is used to calculate the ionization percentage of the drug as it varies at cellular compartments. Example, pH of stomach is between 1 to 3, while of plasma it is between 7.3 to 7.4. The effect of the drug or the response to the drug depends on the absorption level rather than the dosage amount. The pK value of drug, the pH of the GI tract and plasma affect the rate of absorption. Importance of ionization of a drug is it can be interpreted as a weak acid at an acid pH and a weak base at an alkaline pH are more lipid soluble because both of these are uncharged and can readily pass through the biological membrane. pH partition hypothesis. It illustrates the interrelationship between the dissociation constant and the partition coefficient. It states that the absorption of a drug is governed by the dissociation constant, the lipid solubility of unionized drug, and pH at the absorption site if the drug has a molecular weight more than 100. The decrease in pH increases molecular acid, making the drug more soluble, but it decreases the salt concentration. The undissociated form is less soluble in water but can readily penetrate through the media. Hence, while drug designing, a proper balance needs to be maintained between the salt form and the acid form. In general, the partition coefficient is used in combination with the pK value to predict the distribution of the drug in the biological system. The drug should be designed with low log P value to reduce the toxicity, non-specific binding, and bioavailability. The physicochemical properties of a drug can be altered or modified by use of surfactants. These are materials that reduce the surface tension between the water and the lipid at very low concentrations. These surface active agents affect drug absorption, and it depends upon its chemical nature, concentration, and the effect on biological membrane and micelle formation. The surface active agents or surfactants can be categorized based upon the charge they carry, like ionic, neutral, etc. Lower the concentration of the surfactant, greater the rate of absorption. Example, sodium lauryl sulfate is used in the production of hard gelatin capsules. It increases the absorption and solubility. Sorbitan monooleate and polyethylene glycol at very low concentration is used in formulation of suspension to aid dispersion of solid particles in liquid. While using surfactants, the toxicity should also be considered. Hence, it is always used in low concentration. Chelation of drugs. Chelation reduces the rate of absorption of the drug but does not affect the availability of the drug. Certain chelating agents that are used with drugs are iron, copper, calcium with EDTA. 8-hydroxyquinone and its analog act as antibacterial and antifungal agent when complexed with iron or copper. Calcium and EDTA form complex which increases the permeability of the membrane. Dimercaprol is a chelating agent for arsenic and is used as an antidote for metal poisoning. Polymorphism and amorphism. Polymorphs are drug types with morphological structures having same chemical composition but different crystal structures. There are two types, enantiotropic polymorphism and monotropic polymorphs. Amorphism, when the drug exists in an amorphous form, that is, there is no crystal structure. It is called as amorphic. They are at high energy state and has higher aqueous solubility. Pseudopolymorphs. When solvent molecules are entrapped in the crystalline structure of a polymorph, it is known as pseudopolymorphs. Depending upon whether the solvent molecule is an organic solvent or water, they are known as solvates or hydrates. The chirality of the drug or the stereochemistry of the drug affects the physicochemical principles. Stereochemistry involves the study of three-dimensional nature of molecules. It plays a major role in pharmacological properties. Change in stereospecificity of a drug affects its pharmacological activity and different physical properties like dissociation constant and partition coefficient. Stereochemistry, enantiomers, symmetry, chirality are important concepts in therapeutic and toxic effect of drugs as they affect the interaction of the drug with the receptor. Hydrogen bonding. The drug has many bond types. Example, covalent bonds, ionic bonds, hydrogen bonds, van der Waals, dipole-dipole bonding, etc. These bonds affect the drug-receptor interaction and also certain physicochemical properties of the drug. Some of the physical properties that are affected by hydrogen bonding in the drug are its boiling and melting point, water solubility, strengths of acids, surface tension and viscosity, and drug-receptor interactions. We had discussed about various types of bonds while discussing drug receptors. Another physicochemical property of the drug is its protein binding capacity. The reversible binding of protein with non-specific and non-functional site on a body protein without any biological effect is called as protein binding. Based upon the characteristics of the drug, that is, whether it is a acid or a base or neutral, it can bind to many single blood proteins or multiple proteins. Example, serum albumin, acid glycoprotein. The most significant protein involved in binding of the drug is the albumin.
Thank you.